Western Spring Television. Ours it is.
Today, smart devices help us to stay up to date with information from across the globe. Do well to stay up to date with weather forecasts. Follow weather advisories such as during a heat wave. Staying hydrated by carrying a water bottle with you. Keeping the environment cool or at the least well ventilated. Keeping indoors as much as you can between 12 and 3 p.m. especially for children, pregnant women, and the elderly. Wearing light clothes, protective glasses and hats. Taking cool showers, and most important, keeping help and having emergency lines at easy range. It is such a delight to welcome you on board Spring Clinic, live from the Western Spring Television Studios. I am TEMITOPE AjijolaolUwa. On Spring Clinic, we'll delve into everything health and well-being so we can help you not only to feel better, but also bring you information that will help you reduce the risk of diseases, lengthen your lifespan, save your money, and benefit the environment. As is our custom, I will not be on the broadcast alone because, like you, dear viewer, I am also willing to learn more about my health and be better at it. We'll be having the honor of our own medic, seasoned family physician with over a decade's worth of experience under his sleeve, Dr. Ayodeji Ogungbemi, taking us through this session, step by step. Thank you for appearing on the show again, Director Sir.
Thank you very much. Good afternoon.
All right, Doctor, please give us a brief overview of what the human body is.
Thank you for that question. I'm laughing because, okay, the human body.
Yes.
And that's what I've learned for over many years, but in a few minutes.
Sometimes.
The human body, I like to describe it as one of the most complex beings that exists. And it's like saying one should describe what a country is. So maybe I should describe it by listing the components, not the systems now. Component. The human body has different parts, though working as a unit, but yet comprises of different smaller parts. And it is well integrated into that unit system. The smallest part, or the smallest living part of a human body, is what we call the cell. It applies to every living being on the earth. And so the cell in the human body, we have billions of cells. I don't think any scientific detail has given us the number of cells we have in the human body, because cells keep replicating, you know. So it's the smallest possible living unit in the human body. And a group of cells that are similar will be described as a tissue. They are a group of similar cells that perform similar function will be described as a tissue. And a group of tissues, not necessarily similar this time around, but organized to perform a certain function, will be described as an organ. So you can see that it's getting bigger. And then a connection of organs or organ systems, the way some texts will put it. Obviously, different kind of cells, different kind of tissues, organized to different organs, and different organs now coming together to perform certain, not necessarily one or two, it could be so many functions, but they are intertwined, you know. So we can call these ones systems. So the human body is just a bag of so many things working together. So it's we are actually different from other species based on our intelligence. You know, all this I'm describing, you could find it in an animal, but the intelligence we have makes us superior to that. So if you ask me to describe the human body is just a miracle walking on two legs.
Oh, really? That's what doctors do not believe in miracles.
Well, we do. We do. It's not that we don't believe in miracles, but it has to be scientifically backed. It has to be. It must be something I can not necessarily predict, but I should be able to say this is what led to this. So
it must have an explanation.
It must have an explanation to it.
All right, today we'll focus on 6 of the 9 major organ systems, like Dr. has said: the respiratory system, the circulatory system, the digestive system, the excretory system, the nervous system, the reproductive system. We're hoping that Doctor will be able to give us, we want an extensive one, but we really cannot do that on the show. But with all this revelation, so Doctor, let's begin, really. Let's begin in earnest, on what, each of the system is. Let's begin with the digestive system.
Okay. Digestive system, why? Okay. Food
okay.
Matters. Okay, no problem. No problem. That's okay. Digestive system is, we need to, I will not go too much into details because these systems are actually areas of specialty where somebody would have spent several years in mastering. Do you understand what I'm talking about? So there's no way I can, within a few minutes, go into details, but I'll try to explain, at least for every body that is watching will have something to take home. While in the introductory part, I mentioned that different organs constitute a system in order to achieve one or more functions. So different organs have come together, or have been put together by design to aid digestion. That's why it's called digestive system. So you might find some organs that are playing more than one role. I may mention an organ that does something else in another system. For example, the liver is part of the digestive system. It's also part of the hemopoietic system. You get what I'm talking about? So let me talk from anatomical perspective, then we'll go straight. Let's say from the mouth, because digestion will start from the mouth. Or the system starts from the mouth. And that's why we have a lot of things. Maybe with the little I would say, we'll tend to appreciate some things that we have. We have the lips, we have the denture, then we have the mouth, oral cavity, we have the tongue, and it goes straight into the esophagus, to the stomach, from the stomach to the small intestine, from the small intestine to the large intestine, and then from large intestine it goes out. The waste comes out. Now, that is just a tract, because that's like a tube, if you look at it. If you look at it from the mouth, it's just like a tube, goes straight into the esophagus. Now, there's a delicate system at the junction in which the mouth leads to the esophagus. Because at that same junction, we have the airway, that is from the nose, goes back. The mouth is in front, the nose, the nasal cavity. The nasal cavity is on top, the oral cavity is beneath, and at the back is just a big cavity that food air passes through. Okay, the diagram is there. Food air passes through, then food goes to the back, esophagus, then air comes from the nasal cavity straight into the trachea. But we'll talk about respiratory system later. The teeth, the lips are there to help grasp food. It's important. Those that don't have lips, maybe due to trauma, or for whatever reason, have difficulty grasping food substances. The dentures are there to break down the chunk. Let's assume it's yam, piece of yam. The dentures are there, the teeth is there to break it down from the big, yes, to tiny pieces. And then we have the salivary gland, because we're talking about a system now. I've talked about the tract, then I'll start talking about different things that enters into it. We have salivary glands that produces saliva. Now, the saliva, though a lot of times people don't understand or don't know the importance of the saliva. Aside from the saliva causing some form of lubrication, the salivary gland produces saliva that contains different enzymes that helps to break down the food. So while chewing, they also mixing. I hope I pronounced it very well. Mixing the solid food with the saliva that contains enzymes that starts to break down the food.
That's why you said digestion starts from the
Yes,
mouth.
it starts from the mouth. So it starts to break down the food, whatever food you're eating. Even if it's bone, it just starts from there because you crush it, then saliva comes out. Saliva lubricates because you can imagine if there's no saliva, if you are eating, it will be smooth. I don't let me just
really
use
rough.
that people. It will be so rough. It can even cause minor bruises and things like that. But the saliva just lubricates everything. And it starts to break it, and there is a lot of mixing that has gone on. You know, just like I don't know what they call this. I think they call it mixer. Those that produce cement. Those that produce these cement plasters or make bricks. You know, they mix it sand and cement and then water. So it helps the cement and the sand. So that goes on in the mouth. A lot of times people don't understand that. We just eat and then swallow. So by the time it's getting into the esophagus is just a conduit. You know, it's just a smooth muscles. Then it goes into the stomach. Now, in the stomach, something wonderful happens. The stomach can be like, we can describe it like a tank, water storage tank. So the food gets there. Now, different things happen there. The stomach being a container one, that's when people say, I'm full. I've eaten, I'm full. Does not mean that the food has gotten to anywhere. The food is just in the stomach. And the stomach is also a bag of smooth muscle, so it can stretch. And that's why some people after feeding, the stomach is so big. Then once it is out of the stomach, it goes down, you know. I need to say this, while the mixing goes on in the mouth and the swallowing, sometimes you also swallow in air. So the air, because sometimes people say things like, after eating, I belch.
Yes.
I belch. And then they come to us sometimes and tell them, they are clients. Anytime you are swallowing, air goes in with the food. And every time we all know this, air will always be on top. So when it gets to the storage stomach, air will be on top. And after a while, it will look for a way to escape. Then it escapes and comes out. And then when it belches. You understand this? You must have experienced it before. That whenever you belch, it gives like an aftertaste of the meal you
more like
took
a
last.
fragrance from.
Yes, from the last meal. Except there's a problem in the stomach. The aftertaste of belching may be different if there's a problem in the stomach. You know, maybe the food is not being well processed, then it has a foul smell or a foul taste, you know, or there's no food there and the person belches, or while trying to vomit, you know, belches, then it has an acidic taste, you know, sometimes a bilious taste, like bile. So absolutely get there. So in the stomach produces acid.
That's what it produces.
Yes, produces acid. That's why people have ulcers. You know, I want you to
Process that.
Process it.
Because I was going to ask is it the acid the stomach produces that really causes ulcers, or there are other factors?
Since you have gotten to the stomach, so the food has gotten to the stomach.
Yes.
So let us talk about the stomach. So the stomach is a bag of smooth muscles. It has two sphincters. We call it like an opening on top, an opening below, well tightened. So we call it sphincters. That is, it opens to allow food or to either to come in or to exit. And then it closes while trying to, because even in the stomach too, is a bag of smooth muscles. There's a lot of rhythmic contractions that helps to, you know, also break down the food and mix the food with the acid. Now, the stomach produces acid. I won't go into details too much. The stomach produces acid to also help break, just like if you put an acid on this table, it will corrode it. It will just
Yeah.
That's what the acid does to the food. It breaks it down to more processable components. So let me link it up to the peptic acid disease, peptic acid disease. In fact, the general name is acid peptic disease. That is peptic. Oh, I want me to go into details though.
Just
okay, so
in a way
the stomach produces acid. It produces acid normally, but the acid does not, is designed not to corrode the stomach itself. That is the first wonder. Because you will wonder, if something is producing acid and the acid is not destroying it itself, the stomach is laid with a mucous membrane that prevents the acid from eating up the wall of the stomach itself. So there are different glands that produce the acid, but the acid is unable to touch the wall of the stomach because of this mucous layer. So anything that increases, so there's a delicate balance, the mucous layer, the food that is being mixed with, and the acid, the quantity of acid. Anything that affects either of these three can predispose to acid peptic disease. So, number one factor, stress. Stress increases the production of acid in the stomach. So, this, once the acid increases more than the normal quantity, it will have more time to deal with the mucous layer. One. Two, a very common one is H. pylori infection. H. pylori infection is very common anyway. What it does is that organism bores holes through the mucous layer that lines the stomach wall. So once it bores a hole, the acid produced by the stomach has a means of penetrating and getting to the wall. That's number two. Number three, you hear people say things like, okay, he's not eating well, so that's why he has ulcer or symptoms of ulcer. Yes, that's also a factor. If you don't eat well, there are times that the acid will be released, but it has nothing to mix with. So it increases the time to deal with the mucous layer and then affect the wall of the stomach. Now, there are other factors that could also cause it, but because of time. So if the food passes through the stomach, it spends some time in the stomach, depending on the kind of food anyway. It depends on the kind of food. So it spends, I can't put a time to it, but it spends some time in the stomach. Then when the stomach, even the small intestine. Now in the small intestine, you have the liver that has a duct. The liver has a duct into, that's where bile comes from. You know, it is when you have the liver, then you have the bile, the gallbladder. The gallbladder usually contains bile that is very bitter. You know. Now, though bitter, but very important, the bile, once released, helps in the digestion of fatty food. Specifically. If the bile is not released, whatever fatty food the person has taken in goes through the feces, becomes a waste. So usually, we tend to know if the person has a bile problem or a liver problem when doctors ask a question like, when you pass feces, what is the color? If you say it is like white, my feces are like white, then it floats. It looks, we know that, okay, it contains a lot of fats, which means that there's a problem with the bile or the bilious system or the liver at large. So I'm tying our questions to how doctors think. So now the pancreas too is there. It's part of the digestive system where we have a lot of enzymes that also help in our enzymes, we call them ACE. All these things end with ACE. So when people are reading their text, so these are released into the small intestine to help to break down the food. At that time, the food looks like it's no more like chime. By the time you get to it's not like a paste. Like a paste. After the digestion has taken place, or let me say the breaking down, then and until then will there be absorption through the walls of the small intestine. So you find that small intestine is usually a very sweet part. When people deal with animals. Very sweet part because It's very rich. That's where things will pass through. And then it has a lot of blood vessels, because it is through the blood vessels that the absorption will take place and then enters the system. Now it goes from there to the large intestine. The large intestine is largely a retainer. Largely a retainer. So the feces gets into the large intestine, where we call the colon, rectum, sigmoid colon, different parts of it, ascending, transverse, descending colon, sigmoid colon, then the rectum. The rectum is close to the anus, then it comes out. It's just a retainer. Now, I mentioned earlier that by the time you get to the small intestine, we have things like chyme, just like paste. But by the time it gets into the rectum, it's going to spend some time there. If the person has a form of dehydration, that is, water is not enough in the body will quickly send messages to the large intestine that don't allow that feces to pass. So, because at that time, it looks like water. You get it? So, the large intestine will retain the feces and, let me use what, drain the fluid so that the water goes back into the body and then the feces comes out hard.
So that's a problem.
Now, if it comes out hard, it tells us as physicians that the person could be dehydrated or the person will be constipated. Constipation is where you are passing hard stool. You know, so we have to look at it. Okay, is it because the person is dehydrated that's passing hard stool, or something is obstructing it? If somebody tells me that it passes hard stool constantly, then I have to think of, is there an obstruction, or is this person constantly or regularly dehydrated that is causing the, that it becomes like the body is trying to compensate that. Don't allow water to go out. Let us. It happens in urine too. When people say that I'm passing yellow urine, it's not, and they associate it when they are sick. When anybody is dehydrated, you don't have enough water in your body, urine, instead of coming out fast, will be delayed. Water will be taken back, and then the color of urine starts to change to something like yellow. It happens, I don't know what to say, it happens when people are sick.
I would love you to hold that thought. We'll need to go on a very quick break now. But when we get back, we'll start right there from where Dr. stopped, urine. And then we'll quickly get to another system, the respiratory system.
Illegal bushmeat is not cool, but it's on sale in our cities, risking extinction and our health. And many of our iconic wild animals are threatened. So please be cool and say no to illegal bushmeat. And let's make Nigeria better for wildlife and safer for us all. Keep them wild, keep us safe.
James Ajibolaige was a lawyer who obtained his first degree in classics from Nigeria's premier University of Ibadan. Born September 13, 1930, the orator and the polyglot spoke impeccable English, French, Igbo, Hausa, and Yoruba languages. His fine diction placed him among classical orators and public speakers like Cicero, the Roman orator. This attribute earned him the prefix Cicero of Esauke. He authored Kaduna Boy, an autobiography, Detainee's Diary, Constitution, and the People, among 6 other books. Bolaige was a colorful politician, elected governor of Oyo State in 1979 and appointed a federal minister in 1999. He was a pioneer founder of Afenifere, the Yoruba social, cultural, and political group. He invested his political sagacity to propel the group to the height of political leadership and decision-making in the southwest of Nigeria. Bolaige was assassinated on the 23rd December 2001. His murderers are yet to be apprehended till today. Western Spring Television identifies Bolaige as a watershed character in history.
Right, so if you're just joining us, this is Spring Clinic on Western Spring Television, and today we're talking about our organs, our system, and the respiratory system, like I said, the circulatory system, the digestive system, the excretory system, the nervous system, the reproductive system. But presently, we are dwelling on the digestive system, and Doctor has really been doing justice to that. Before we went on the break, we talked about, I stopped you on the part where we're talking about the urine and the color and what the specifics are.
Yes. Okay, thank you very much. We are back. Well, the urine, though the part of the urine is not part of the digestive system, but we got on it trying to talk about how the body conserves water and how a lot of people misinterpret it to mean different things. So what led us to that was the issue of passage of hard stool. That whenever someone has not taken enough water, the colon, that is the large intestine, there's a message that gets to it that don't allow this waste product, as it were, plus water to pass out. So just hold it, let's drain the water before the waste comes out, and that leads to passage of hard stool. Now, then I now linked it up to that of urine, that it's the same system that happens in an apparently well person that takes enough water. Urine should be colorless, should be like water, just be colorless. But urine also contains a lot of waste products. Now, these waste products, they have their color, but because it is well diluted, I'm using normal words just to convey the message. Well diluted, so it comes out like normal water. That's why I hear people say things like, yeah, urine looks like water. It's good, fantastic. Or maybe at worst, maybe amber color, not yellow, just a little bit,
Different
like a
from
tinge
water.
of, yes. But when a person is dehydrated, that is, does not have enough water in the system has a way of, there's a check and balance operation in the body. So there's a message that goes to the kidney that we need water. You usually, dear kidney, usually pass out waste products with water. Don't allow water to go. So what the kidney does that, it tends to take in more water so that the waste products will now be more concentrated. That now deepens the color of urine. Then you have people say things like, my urine is yellow in color, and they associate it, may not be entirely wrong, they associate it with being ill. And the simple logic is this: when people are ill, they don't drink water and they don't eat. So their body tends to compensate by, taking water out of their urine, and then their urine appears concentrated. So if you want to try what I'm saying now, just try not to drink water for several hours and see how your urine looks. It starts to change color. You get it? So, however, there are other disease conditions that appear in different colorations in the urine, including the passage of blood. It could be as bad as that. Including the passage of dark-colored urine. Dark-colored urine is not yellow. Dark-colored urine is like, the urine is black. I don't want to mention the name of a particular beverage, but we use it a lot in the health sector in Nigeria. The urine is black. It's like coal. Coal when you add it with water. So it means a lot. So let's go back to the digestive system.
Yes.
So when the feces is hard, we call it constipation. Now, we won't say constipation every time that it is hard, because we know that once in a while you didn't drink enough water, either directly or your food, so the feces is hard, or you didn't pass feces when you should pass it, because everybody has a rhythm. Some people's rhythm is twice a day they pass feces. They pass two, the way people call it. Some people, their rhythm is once a day. Some, it is in the morning. Some, it is at night. Everybody has his own rhythm. But if you miss your rhythm, you will find that your stool will be harder. Because the stool will spend more time in the rectum. And the rectum will, the more it is there, the more what, the rectum is like it absorbs water from the feces. So the longer it stays in the rectum, the more hard the stool becomes. Now there's a problem. If it stays hard, when it is coming out, you understand? It becomes painful. It becomes painful either because it is causing a bruise. It's so hard that it is because the intestine till the anus is lined with a very thin membrane, very sensitive, because there's a lot of absorption that needs to take place. It is at the junction in which it meets the anus that it now becomes something like the skin that we have around. You get it? So it's so tender, so gentle, so like a nylon, you know? So when the stool is hard, it causes a bruise or a tear. Now, the first one is not the problem. Whenever there's a bruise or a tear, eventually the feces comes out because the person, you know now, then comes out.
Yes.
But there's a bruise or a tear. The next feces that wants to come, the next waste that wants to come out, there will be so much pain around the anus. And because of the pain around the anus, it will cause spasm of the anus. So the anus, because of the pain, instead of the anus to relax and allow feces to come out, the anus will constrict due to pain, just like muscles do. If I prick you now, there's this.
Yes.
So the smooth muscles there will further worsen. It will not allow the feces to come
out in whole or
if I do not even allow it to come, because the person is like, it's painful, it's painful. Even sometimes deliberately, the person holds the stool and my nose is paining me. My nose is paining me. Now, don't forget, the longer it stays in the rectum, the harder it becomes. Which means the situation becomes worse than the first one. So it now becomes a problem. Sometimes they come to the hospital and then we help them out. And now, let me now maybe try to round off. If they force it, whenever there's that tear, you now say things like, when I'm passing my feces, blood. I see blood. Now, at any level in the digestive system, blood can mix with feces, but it will appear differently in the feces that comes out. And let me just explain that. Let me start from the top. If I take in blood, let us assume that I swallow blood now. You will not see blood in my feces because the acid in the stomach will work on the blood. The enzymes that gets into the small intestine will work on the blood. So there will be a lot of discoloration, breaking down of the cells of the blood and everything. So you won't see blood in my feces. If the blood is much, what you will find in the feces will be, it will not be frank blood, it will be like a dark colored substance. And by that time, it should have been well mixed with the stool, because the stool too has been, throughout the intestine, the thing is turning and turning and turning and turning. So it is turning with the blood, with a lot of coloration, acid working on it. Then it changes from the red to the black color. So when doctors ask, somebody says, I have symptoms of peptic ulcer, because we know that peptic ulcer can be complicated by perforation or bleeding. So if blood gets into the stomach, what will be seen in the feces will be dark colored stool, because the blood has been discolored by the acid and other digestive enzymes, so it now becomes black, and then it is well mixed with the feces. Except the volume of blood that is produced is so much that the acid in the stomach cannot fully discolor it, but it will still be well mixed with the stool, because while they are turning and turning, the intestines are turning it, the blood is meeting with feces. But anything coming from the lower GI, lower gastrointestinal tract, acid is no more there. The blood will remain red colored. So you say things like frank colored or dark red. And if it comes due to that tear of the feces, or the hard stool, it will look like a streak. A streak is like a line. The person says that when I pass the hard stool, it's just like a line on the feces. The blood was just there, lined it, or then at the top, When they finish passing the stool, nothing, the blood now.
Dirt.
Hope I'm not.
But doctor, at what point does digestion end?
That's a big question. I want to put it this way. Largely, anytime it passes through, goes past the small intestine. Largely. Because by the time it is off the small intestine, you don't really have nutrient absorptions too much. What you now have is water. So in the colon, ascending, transverse, descending, sigmoid colon, is more, as I mentioned, there's more of a storage part where water is being absorbed. But to look at it holistically, because water too, going back into the system is also part of the entire system. So until the food comes out into the toilet, the system keeps working. So I would say holistically, until whatever we have eaten, the waste product gets out, the system keeps working. The system keeps working.
All right. There are some times when we pass stool, we find, maybe let's talk about grains now. You find a grain, wholly in your food. And sometimes you cough and you find something coming out of your mouth. What happened? Why was it not, broken down at that point?
Okay, let me start from the grain in the stew.
Just like in some minutes.
Sometimes you just find maybe granite in the stew. Abi? We should ask ourselves, did the person chew very well? A lot of people don't chew enough. Because, our tongue is so blessed. We have different sensations in the tongue. And thing is so sweet. Just swallow. So, usually we tell people, chew before swallow. If the person had chewed well, that grain cannot be there. It cannot. C-A-N-N-O-T. It cannot. It simply means that that grain escaped chewing. And there's a difference because by the time you get to the stomach, it should have been broken down. So, but it's getting to the stomach, there's still a whole grain. So what the acid will do, we just work on the surface of that grain. I don't know if you get it. It won't have enough time to eat deep. And by the time it's getting into the small intestine, it's going to come out almost like that. Because nothing will break it down.
Well, I have several questions, but I'll just touch on
No problem.
What does water actually do? Does water really aid digestion?
Yes, it does. I like using different analogies to make things easy. If you want to blend whatever you want to blend, I'm sure you usually put water. So does water aid blending?
Okay. Very.
that answers that.
Yes.
Because without the water, it will be difficult to grind. It will be difficult to. There will be a lot of friction. It will not flow. Don't forget, when people have issues, maybe they chew something and they try to swallow it, and then they have the sensation that the thing is stuck. Take water, and the water pushes down. Then the water helps in the mixing, in the breaking down. I think the blender analogy solves it.
One other question, doctor. You talked about the fact that when we eat, in the stomach, air is usually on top. Sometimes we belch and this air comes out. What happens to the air that comes out from the anus, the fat? Is it the same air? Why did we not belch all of the air out and we have fat?
Well, two things, or maybe three things. Now, the one we belch is one we swallowed. Largely is the air we swallowed. Then the little is produced from the breakdown of food that happens in the stomach. Very little, but largely from the swallowed air. Now, part of the air will also go into the small intestine, part of it. Not all will come out. As all of us are now, we have air in our stomachs. Your stomach cannot be completely empty. Something must occupy. The way nature is, something must occupy something. And the stomach is not a vacuum. So it's either food or air is everybody's stomach, or both. So some will come out, belch, Now, the one that goes down, don't forget, it will mix with a lot of things. You understand? While the digestive process is on, it will mix with a lot of things. Some things will break down. Then for some air or some gaseous waste can also be produced as food, or some type of food are being broken down. Let me give you a picture. Beans is common with this. If you have beans, it's not about when I eat beans, I belch and I fart. That's if you put beans, cook beans and then cover it. Don't just let it spoil. Now, the spoiling we are saying is because it's giving us a foul smell and things like that. Is that it is being broken down. It's being broken down. So you notice that if it's a metal pot, once you open it, you will see bubbles over the beans. You see it. It's not only beans. That happens with rice. That happens with almost all meals. Because once it's being denatured, air will be produced. Now, you can imagine what goes on in the stomach. Air is produced. So the air that comes out, based on the whatever is being broken down, now comes out as fat. Now the fat may be foul smelling based on the nature of what is the gas is coming from. And it may not be foul smelling based on the nature of what is broken down from. I don't know if that answers the question in a little way.
Yes.
Okay.
Yes.
I hope I've done something.
All right, Doctor, thank you. I thought we were going to, talk about other systems, but really, I enjoyed this. And I still have questions, but we really cannot go into that. All right, so dear viewer, we've been talking about the digestive system, really, and it's been interesting with Dr. Ayodeji Ogungbemi. All right, other systems that we'll be talking about later on the show, on another episode of the show, The Spring Clinic. The respiratory system, especially, we're going to be starting from there, next week, the respiratory system. The circulatory system, the excretory system, the nervous system, and the reproductive system. We've talked about digestive system today, which is a part of it. So with all this revelation about your body and how it functions, anyone found guilty of defaulting at taking proper care of their body will be charged and prosecuted at the highest court of medicine. Happy, Doctor? All right, and that is an experience, not what's going through. You will attest to that, really. I look forward to another highly insightful edition of Spring Clinic on your channel of choice, Western Spring Television. I am TEMITOPE Ajijolaoluwa. That's it.